Hey guys, it's Trish, and today I have a more serious, depressing vlog for you. So if you can't handle real talk and people's real lives and emotions, then please just go away. If you're going to say mean things, go away because nobody cares. I probably will be crying a lot, so if you don't like things like that, then here's your warning. So if you've watched some of my videos, you might have heard me mention once or twice that I was very close to my grandmother growing up, and she pretty much raised me most of my life. And we were always best friends. Like, I would go to work. I would call her while I was driving to work most days. I would call her on my lunch break, and then I would call her after work a lot of times. Like, we talked constantly. If I wasn't at her house, I called her on the phone nonstop. We were best friends, and I love my mamaw so much. That's what I call her, mamaw, not grandma. But she, in 2010, in August 2010, we started noticing a big change in her. She started being very forgetful. She stopped calling me. She didn't really seem to want to talk to me, and I thought she was mad at me, and I couldn't figure out why. I started asking my family, like, is Mamaw mad at me? Do you know? Did I do something? And they all was like, I was going to ask you the same thing. She seems not herself lately. She seems like she doesn't want to talk to us either. And I was already going through a very emotional time that year in August. I had a breakup literally, I don't even think it was 2 weeks before my birthday. So, and it wasn't like, you know, a few months we dated. It was a couple years of dating. This person left me for somebody else. So, very dramatic and crazy. We won't get into all that. But anyway, I was not in a very good spot in my life. We'll say that. I had a very hard time with that, as well as I just started a new school, and my car was acting up. I didn't have a car half the time, so I had a lot going on. And all that just really, it's like that was my breaking point, I guess you would say. Because, you know, I finally took her to the doctor one day. I told them, I was like, guys, we have to take her to the doctor. Something is not right. Because she just stopped remembering things. She started using the restroom on herself, and I didn't know what was going on. I was like, this is not normal. So I freaked out. Me and my cousin took her to a doctor. The doctor immediately sent us to the hospital because her blood pressure was so high. The doctor was actually really pissed off and was like, you guys should not have been ignoring this. And my mamaw's really stubborn. She always refused to go to the doctor most of the time. Well, it turns out she quit taking her blood pressure medicine, and because of this, we found out at the hospital it had caused several series of mini strokes, which caused damage to her brain. And it really affected her cognitive skills. So if you don't know much about that, it's just, it really affected her short-term memory. At that time, she remembered a lot of things in the past, but couldn't remember much, you know, presently. So, they did a lot of tests, and we were in the hospital for about a week with her. Me and my cousin would, you know, stay there with her. And it's like I would go to work, school, then go to the hospital, and I was so worried about her. Well, then all of a sudden the doctor told us that she had Alzheimer's. And I just, like, fell to pieces, because pretty much everybody knows what Alzheimer's means. It means basically those people are going to lose their memory and kind of lose their identity, I feel like. So that was, in my mind, that was so hard to imagine that my mamaw would not remember who I am eventually, you know. And so I was very upset. But then the other doctors was talking about dementia, so I'm like, you know, like, it's two different things, but they are very similar. So then I started studying it, and, you know, the one doctor was very persistent on saying it's just dementia, which could just be caused by the many strokes, which means her condition might not get worse, and the brain can actually heal itself sometimes if the damage is not too severe. So there was hope, you know. But then the one doctor's like, no, she has Alzheimer's, and these strokes have set her into it quicker than she would have been. So it was very frustrating for my family, because we had no idea what was going on. And so finally, she got a real diagnosis, and it was Alzheimer's. She got put on a medication, and I honestly don't know the name of it. If someone's interested, then I could find out. But long story short, she took it for about a year or so, maybe 2 years, maybe a year and a half, somewhere in there. And it seemed like it maybe made her not decline more. I don't know it. But all her medicines, I feel like, made her kind of like zombie-ish. So she was always sleepy all the time and kind of just not herself. So it still didn't make us feel much better. I mean, yes, she's alive, but she wasn't herself. My papa, before he passed away, her husband, asked us to stop giving that to her because he felt like it was causing more problems. Well, finally they did that. And it seemed like she was getting a lot better. So I thought, wow, he was right. You know, maybe it was the medicine. Like, again, there's all this false hope that maybe it's the medicine doing it. You know, the doctors just was so back and forth with all their information that it made it worse, you know. It's like, if you don't know what it is, then just tell us that you're trying to figure out. Don't just keep making crap up because you know, to give us an answer. Like, we just, you know, it's fine to tell us you're trying. Just don't make it up, you know. So it's very frustrating. Well, a little over a year ago, something like that, I don't know if it was my stepmom or my cousin that took her to the doctor, but they mentioned Alzheimer's, and the doctor said, she doesn't have Alzheimer's. What do you mean? You know, they said. And they were like, oh, well, it's vascular dementia. It's quite similar to Alzheimer's. So it's like, what the hell? You know what I mean? Like, so now there's a completely different diagnosis that we didn't know about. And I will read you what that is. So vascular dementia is quite similar to Alzheimer's. It's a decline in the thinking skills. It's caused by a condition that blocks or reduces blood flow to certain areas of the body, especially the brain, which deprives the cells and causes cell damages, which then causes, you know, the memory losses and, you know, ways of thinking. In vascular dementia, changes in thinking skills sometimes occur suddenly following strokes that block major brain blood vessels, which I think happened with her. Thinking problems also may begin as mild changes that worsen gradually as a result of multiple minor strokes or other conditions that affect smaller blood vessels. But it says, you know, vascular brain changes often coexist with changes linked to other types of dementia, including Alzheimer's disease and dementia with Lewy bodies. Several studies have found that vascular changes in other brain abnormalities may interact in ways that increase the likelihood of dementia diagnosis. So I think that's why it was so confusing and hard to diagnose her. So I'm just basically making this video right now for therapeutic reasons. I feel like I have nobody to talk to about this. Like, literally nobody. Not even my family. Because my family tends to make me more upset. Like, they don't ease my pain. They make my anxiety go crazy. They make me feel worse. And they don't mean to. Like, it's just, they're upset too. They don't know, they also don't know how to feel about it. So, I mean, I try to talk to them, but sometimes they make it worse, and I know they don't mean to, like I said. And then my friends, I think they just get tired of hearing about it, because it was 2010 when she was diagnosed. It's now 2015. Nobody wants to hear about it anymore. Everybody thinks you should just move on, and they don't want to hear about it. You know what I mean? So it's like, I feel so alone that I don't feel like I have anybody to talk to. Even people I know who have, like, grandparents and things that's had Alzheimer's and dementia, like, I feel like they don't even sympathize with me like you would think. But I feel like because I was so close with my mamaw, that's what makes this so hard for me. Not to say that it doesn't make things hard for my friends who've dealt with this, but because she's like a mother figure, it's made it very difficult for me. Because like I said, I talk to her on the phone multiple times a day. Now, I maybe talk to her on the phone a few times a month, maybe. I might see her once a month. Sometimes I try to call and sometimes I don't. Sometimes it's my own fault, but she doesn't talk very much on the phone. So I feel like every time I try to call, I just get upset. So I feel like it's something I avoid. I try to avoid it because I don't want to hurt. So I just avoid it, which isn't good, you know. Well, my cousin tried to call me yesterday, but I was at work, so I talked to her today. She took her to the doctor yesterday, my mamaw. She took my mamaw to the doctor. And she had a very bad urinary tract infection, which if you don't know, a very bad urinary tract infection, like the one she had, was very bad. It can cause some memory loss and hallucinations. So, we're hoping that's what it is, but the doctor did say that it seems like her dementia is getting very worse. Like, she's declining very quickly. And, but they want to make sure it's not just the UTIs causing the hallucinations first. But if it's not the UTI and it is the dementia, then they're wanting to try a new medication, and it has horrible side effects and risk, and you get to the point where you're like, is it worth it? Like, should we just let her live what she can, like a quality life, like stop taking all this fucking medication that makes her not think clearly, that makes her tired and sleep all day? Like, how is that much better? You know what I mean? But at the same time, we're selfish and want her here. We want to keep her. But I feel like she's not happy because I feel like some days when I talk to her, mostly when I see her in person, there's rare occasions when she's my mamaw, I call her. Sorry. There's rare occasions when I brought the tissues because I knew I needed it. There's rare occasions when she makes sense and talks like her old self. And she tells me, I just want to go home. And she's very religious, or she was pretty religious, Christian. So she doesn't mean go home to her old house where she lived by herself. She's talking about heaven. So I know she wants to give up. And it hurts so bad to see her that way. Because she cries and says, I want to go home. And at first I was like, you mean your old house, you know, with Gail and everybody? And she's like, no, I want to go home with Daddy. And her dad, of course, has passed away years ago. So I feel like she's basically telling me she wants to die. And it breaks my heart. But I'm like, who am I to tell her, oh no, you gotta keep going and keep trying all these medications that they're basically testing on you? Because all these medications are pretty new. Like Alzheimer's, there is no cure, or dementia, all that. They're just testing these drugs out on our family members, our loved ones, everybody who has this disease. It's a test. They don't know if it's going to work. They may see results, but they don't know if it's going to work. But that's like most diseases. They don't know if it's going to work. It's always a guessing game. So you get to that point where you're like, do I want to put her through this anymore? Should we just let her live the way she would live without medication? I don't know. Like, I don't have the answers, and again, we're selfish and want to keep her as long as we can, of course. But would she want to be here? It doesn't sound like it. So it just gets very confusing and hard, and you don't know what to do. So right now I'm just sad, emotional. I did talk to her on the phone though, and she did talk a little more than usual. We were talking about music, and for some reason, music, I'm telling you, if you have a family member or friend or whoever who has dementia, Alzheimer's, vascular dementia, any of these, play music for them. They love it, and it helps them. It's like therapy. If you research online, there's tons of studies talking about music therapy. But anyway, every time I play her favorite music that she used to listen to, she smiles and she's happy. And even if she's not talking, she's just happy and content. And that's all I need her to be. So on the phone, for Christmas I bought her a CD player, like a boombox. And I know hardly anyone uses those anymore. But I knew she would, you know. So I asked her on the phone, I said, hey, have you been listening to your radio? And she's like, yes, I love it, you know. And so I started singing a few songs that I knew she used to listen to. And I could hear her smiling, you know what I mean? Like, you can hear the person happy, and then she kind of laughed. And I said, who sings that? And at first I couldn't remember, to be honest. I was like, oh crap, who is that? And then I said, you know, the first name. And then she's like, oh, and then she said their name. So she remembers, you know, when you give them like a sample of something, it seems like it takes her a minute to think, but then it clicks. The piece goes together, the memory. And I feel like music just helps her so much. So if you know anyone with this disease, definitely try some music therapy just to get them content and happy. because it is hard to see them sit there confused and dazed. Like, she just sits there like just so confused, and I hate that. So I don't even know why I'm recording this. I guess for therapy, because I feel like I have nobody to talk to about it except for my family. And like I said, they're all upset too, so it's like, I don't know. It helps, but it doesn't help sometimes. So, I don't know, I just feel like I have no friends to talk to about it that can bring me up. So, I feel like this might help me, sharing this with you. And also it might help you guys, because maybe you feel the same way. Maybe you are someone who is in a situation similar to me, and you feel alone. Well, you're not, because unfortunately it affects a lot of people. And it can actually affect people as early as 30. So it's very scary. I hope that if you didn't know that already, that maybe music therapy can help your loved one. There was a lady, somehow I found her on Facebook. I think it's one of my friends that I used to work with. She was friends with her somehow. But there was a lady named Barbara, the sweetest lady I'd ever seen. Her daughter made her a Facebook page, and it was basically an Alzheimer's awareness type page, and she would have little video clips and things. She seemed like such a sweet, cute little happy lady, and I loved her. And unfortunately she passed away about a year or two ago. And I used to follow her on Facebook. I love to see updates about her and her videos especially. I will link that down below. That way maybe that'll help you guys out to see some of her old videos and information. But yeah, it's just, it's hard. But I'm just gonna go ahead and stop now, guys, because I could go on and on talking about the same thing over and over. I'm just getting repetitive now. I hope that helps somebody out there. I hope that maybe somebody doesn't feel so alone now. It definitely helps me to talk about it, even if I'm just talking to my camera. Because used to, when I did YouTube videos, I felt awkward staring at my camera, because I'm like, why am I talking to myself? Now I feel like I'm actually talking to you, and I am, because you guys comment and talk to me and send me messages, and I love it. So that's why I'm making this, because I know there's somebody that's going to watch this and it's going to help them. So if you haven't subscribed already, guys, go ahead and do that, because I do put out weekly videos. Normally they're not this depressing, I promise. Usually I do a lot of shopping and product reviews and hauls and you know, skincare advice, things like that. If you're interested, subscribe. Give me a thumbs up, guys. If this helped you at all, comment down below. Did you have a loved one who suffered from any kind of dementia, Alzheimer's, vascular dementia, anything related? How did you guys handle it? Do you have any advice? Thanks so much for watching. I know this was very depressing and not very uplifting, but it was so nice that you stayed and watched this if you're still watching, so thank you. I really appreciate that. But I would love to connect with you, so please comment down below, especially if I haven't ever talked to you before on my channel. I would love to meet new people. Thanks again, guys, and as always, you can come shopping with me. I'm not gonna tell. I know, that wasn't a very convincing smile, but I'm just sad today, so thank you for your support and love. I love you guys.